One American dies of oral cancer every hour of every day. I'm Dr. Larry Hamburg, and I'm here to tell you about oral cancer, about my experience with oral cancer, and something about early detection devices that can help you make a difference and maybe save a life. The reason that I'm here today is to implore dentists and dental supply people, if you will, and anybody to have their oral cancer screenings, because we believe that if you find this disease early, if you find it in stage 0, as we believe the Trimera product, the Identify 3000 Ultra, can identify a precancerous lesion. If you find it at that time, you have an 80 to 90% success rate for stage 0, stage 1, possibly even stage 2, I believe, has very good cure rates. Stage 3 is closer to 50% cure rate, and stage 4, as I said, is about 78% of the people don't survive. Over 40,000 people a year are being diagnosed with oral cancer in America, and over 400,000 throughout the world. We believe that it's because of the increase in human papillomavirus, in particular HPV 16 and 18, that are causing the increase. In particular, oral sex, we believe, has a lot to do with the increase in oral cancer. One day, I was buttoning the top button to put my tie on, and I realized there was a little swelling, a little lump, and it felt kind of hard. And I said, oh, I remember the name for this problem, this symptom, if you will, unilateral lymphadenopathy, a swollen gland on one side. And looking back on it in my 25 years of dental practice, I never saw that in myself or in a patient, but still I kind of wrote it off. I said, I must have an infection draining on one side of my face. It also occurred to me that it might be cancer. It's me, I don't have cancer. Young, I was only 51 years old. I hadn't smoked since I graduated dental school. I wasn't a big drinker, and I really didn't think there's any reason why I would have oral cancer. And I went 6 months without having that lump checked. One of the most difficult things I've ever had to do in my lifetime was to tell my children, tell my boys that I had cancer. So after about 2 weeks, I decided I was going to tell them, and I thought I'd tell them individually. I started with my oldest boy, Jamie. He said, Dad, I know you're really sick, you're a really strong guy, and you're going to be okay. And it's not like you have cancer or something. And I said, Jamie, I do have cancer. And then he started to tell me that lots of people get cancer, and not everybody dies from cancer anymore, and that the scientists have come up with such great discoveries that there's no reason to think that I'm going to die from this. And he was so positive that I knew that I had to get through this. I found out that there are many early detection techniques and devices on the market, and I found out that the best one is the fluorescent technology. I've determined now through my discussions with the top authorities in the country, and I believe in the world, that the best device is Trimera's product, the Identify 3000. They've just come out with the Identify 3000 Ultra. The thing that makes it unique and makes it the best, in my opinion, is the 3 modalities of light. One being the traditional white light, which substitutes for my office overhead light. And it works better than my office overhead light because the machine can get into the mouth and point through reflectance or direct light, point light on the area that I'm looking at. In addition, there's the violet light, which through fluorescence shows healthy tissue, which fluoresces violet, and unhealthy or dysplastic tissue, we believe not only cancerous but precancerous lesions appear dark. Then the third modality of light is the amber green light, and that shows increased vascularization. We know that tumors show increased, and not only increased, but irregular vascularization. So if you see something with this green light, with the amber light, that looks a little different, it also suggests that it's time to go further. One of the things that I love the most about it is this little mirror here, because I feel like somebody can look in the back of the throat and could have found possibly my cancer, could have found my base of the tongue tumor. And the highest percentage of squamous cell oral cancer lesions are at the base of the tongue. So devices that you can't see the base of the tongue, that you can't see back there, are probably not going to work as well, in my opinion. It's really important to me that you do an oral cancer screening with an adjunctive device. In my opinion, it should be done on every patient 17 years and up. In fact, I want to quote Jerry Kugel, if I may. He said, if you will, in my honor at one of the seminars we gave together, he said that if you don't do oral cancer screenings, you don't deserve to be a dentist. What I'm imploring dentists to do is realize I want you to use the early detection devices. I want you to do the oral cancer screenings, but I also want you to have your own oral cancer screening. I went to the periodontist every 3 months from the time I graduated dental school, and I never had an oral cancer screening. And I guess he thought that somebody else was going to be screening me. Together, we can catch oral cancer early, often, and accurately. And together, we're going to save lives.